Shri RP Thakur,
all distinguished guests on the dais, ladies and gentlemen, it's a proud privilege for me to be amongst all of you. Though looking at my background, I find most of the time that I am the most unfit person for all these occasions, because being an engineer and then switching over to policing, somehow I landed up in this department of drug control administration 6 months back, and most of the time I tell my officers also that the most ineligible, rather the person who knows least about the department is your head only. All of you are more knowledgeable and more knowledge about the things in this department. But of course, I am doing my bit and trying to streamline the system to the best possible as administrative head. And today, after I got the invitation from Omics Group, I thought it will be the right occasion to put forth my views, some of the concerns which society is facing, or some of the concerns which we as a regulator we are having. Now you know that Andhra Pradesh is one of the leading center as far as the manufacturing of the drugs are concerned, and drug industry in Andhra Pradesh over a period of time, it has moving up, going ahead in many aspects. It is on the first place as far as bulk drug is concerned, and almost in every field it is in the top 5 places. And drug industry in coming days has a great potential. All of us, I as a head of this drug control administration, what my effort is to see that it goes further up, things are improved. We have a strict regulation as well as it should be industry friendly. Many cases where we find that the rules and regulations which are not industry friendly and where we have lots of bottleneck or some constraints, we try to remove those constraints and try to move forward. In this regard, I always all sorts of suggestions and which can improve the system is always welcome. Rather, I call up the industry people and say that you please come forward if you need anything from my side, which will help in your business, which will help in the standards of in improving the standards of drugs. I will be too happy to implement those changes. But now in the recent times, like all of you must be knowing, especially the clinical trials, there have been lots of adverse publication, criticism in the media, among the